Hi, my name is Erica and I'm a physical therapist at Maine Medical Center. My hope for this video is to provide you with some helpful information as you prepare for your upcoming total joint replacement. As a physical therapist, I'm going to be part of the team that will work with you during your admission to instruct you on your therapeutic exercises, functional mobility, ambulation, and other safety information prior to your return home. We will ask you to have a couple of different pieces of equipment to help walking be easier after your surgery. Please bring a rolling walker with you on the day of your admission. This is an example of a rolling walker. It has two wheels in the front, has two pegs in the back. This type of walker is adjustable to an extent. However, if you are 6'4" and your mother is 5'2", you will not be able to borrow her walker. When you stand within the frame of the walker and let your arms drop down to the sides, you do want the handle to be hitting you at about where your thumb meets your wrist. This lets you do a quick and easy size if this type of equipment is going to be the appropriate height for you. When you start walking with your bedside nurse or your physical or occupational therapist, they will have you stand within the frame of the walker and just push it like a shopping cart. So you're going to push it ahead of you. You're going to stay right within the frame of the walker and go right along with you. If you've used crutches in the past and are very comfortable with the crutches, your physical therapist can work with you. However, this will always remain the gold standard for type of equipment to walk with after any kind of total joint replacement. Other types of walkers that are available on the market that are not recommended after your total joint replacement are, this is a standard walker. It looks similar to a rolling walker, however it doesn't have the wheels in the front. So it has 4 pegs instead of 2 wheels and 2 pegs. The reason that we don't recommend this type of walker is that it doesn't slide, so you're going to have to pick it up and be a very discontinuous gait pattern. The good thing about this type of walker, however, is that you can obtain the wheels and swap out the pegs for the wheels. That can be done at a durable medical equipment store prior to your surgery, or your physical therapist can help you with that during your hospital admission. We also get a lot of questions about this style of walker. This is called a rollator. And although they're often called the Cadillac of walkers, they are not recommended after a lower extremity total joint replacement. The reason for that is that they get away from you too quickly. You don't have enough control when you have lost strength or range of motion in one of your legs. The other reason that we don't like this type of walker is that the built-in seat does not promote upright posture. So in order to accommodate the seat, you have to keep the walker out in front of you, and then you're walking bent over. Okay? So if this is the only type of walker that you have access to, please talk to your doctor or the surgical team about getting you a prescription to having a rolling walker. That can be done before your hospitalization or while you're here. Last piece of equipment, we will ask you to have a cane upon your return to home, but you do not need to bring it with you in the hospital. If you only have one railing on your stairs at home, we'll show you how to get up and down the stairs or climb and descend the stairs using one railing and one cane, but we are happy to lend you our cane during your hospitalization. I'm just going to do a quick demonstration of how it looks like climbing the stairs. So say if I had a left knee replacement, I'm actually going to go up with my right leg. So I'm up with the good leg, operative leg comes to it. Okay, you're going to go one stair at a time. If your bedroom's located on the second floor of your home, we'll teach you how to go up and down the stairs appropriately before you return home. On the way down, you're going to do the opposite sequence. You'll hang onto the rail, cane in the opposite hand. Cane will come down first. Your operative leg, or in my case, the left leg, will come down first. Again, one stair at a time. Cane, operative leg, good leg. I'm going to take you through a few exercises that we're going to ask you to do for the first 3 to 4 weeks after your total hip replacement. Here we have Liz. Liz is going to be my patient for the day. Hi, Liz. Hi, Erica. Hi. I'm going to just have you go through a few exercises that you're going to do after your hip replacement. And we're going to ask you to do these 3 times a day, spread out throughout the day, all right? We're going to assume that Liz had her right hip replaced, okay? The first exercise we're going to have her to do is just to gently wiggle her ankles up and down, like she's pushing on the gas and then pulling hard up off of them, okay? You can do anywhere from 30 seconds to 30 repetitions of this exercise, okay? Awesome. Great exercise for circulation. Okay, the next exercise, number 2 on your sheet, is called quad setting. What you're going to do here is to gently push your knee down into the mat, okay? By tightening up your quads here, you're going to be flattening that knee into the mattress. Hold that contraction for about 5 seconds, and then gently relax, okay? I want you to focus on the operative side, but you can do this on the other side at the same time as well. Okay, we're going to do a total of 10 repetitions. Do one more. Excellent. The next exercise we're going to have you do is called a gluteal setting. So this is another what we call isometric exercise, but instead of squeezing your quads in the front, you're going to be squeezing your glutes in the back. So for this exercise, you're going to be gently squeezing your butt cheeks together. Hold for about 5 seconds, and then relax. All right, again, we're going to get to about 10 repetitions of this one. All right, go ahead and relax for me, Liz. The next one we're going to have you do is called a supine heel slide. For this exercise, I'm going to have you keep your heel on the mattress or the bed, and you're gently going to be bending that knee up towards your chest. Pause at the top, and then gently come back down. Okay? Don't feel as though you're going to get your maximum range of motion on the first repetition. The goal should be to go a little bit further each time you do it. Great. You should feel a gentle stretch. This should not be terribly painful at all. All right, good. Go ahead and relax. The next exercise is called a short arc quad. You are going to need some sort of a bolster. You can use anything from a rolled up yoga mat to a beach towel to a pillow. This is going to gently slide underneath the back of your operative knee, okay? You're going to rest the back of your knee on the mattress or on the bolster, and you're going to lift that foot up to a straight leg. Pause for up to 5 seconds at the top, and then focusing on the control on the way back down to the bed. Okay, so gently come up, and then not allowing that foot to flop back down to the bed on the way down. Good. All right, thank you. The last exercise will depend on who completed your surgery. What we're going to have you do here is to do part of a snow angel. This is called hip abduction. So using the muscles on the outside of your leg, you're going to be contracting and sliding this leg out towards the edge of the mat. Okay. Good. I want your toes and your knee pointing up towards the ceiling the whole time. And only go as far as is comfortable for you. So again, to recap, we're going to do these 6 exercises 3 times a day for the first 3 to 4 weeks after your surgery. Today I'm going to educate you on how to complete phase 2 of your exercises following a total hip replacement. All right, this is Liz here. Liz, we're going to start doing these exercises about 7 to 10 days after your surgery, okay? At this point, you can still be doing your supine exercises, but this is in addition to those initial exercises. These are all going to be completed in supported standing. What that means, you're either going to be hanging on to 2 hands on your walker, kitchen countertops, the back of a chair, a bathroom sink are all appropriate places to do these exercises. So for your exercise, you're going to be standing on your quote-unquote good leg or your non-operative leg. So we're going to assume that Liz had her right hip replaced here, okay? She's going to be shifting all of her weight onto her left leg, and for exercise 1, she's going to be gently bringing that leg out to the side, okay? I want her torso to stay up and down, and only coming out as far as is comfortable. All right. Great job. Okay, the next exercise, what we're going to do is this is called standing hip extension. So again, keeping her torso up, hands on surface in front of her, she's going to be contracting her glutes, her butt muscles, and pulling that leg behind her. All right. Good. Keeping the legs straight, torso up and down. Great. You're going to be completing 10 repetitions of all of these exercises. All right, the next one we call a standing hamstring curl. So again, hanging on in the front, what Liz is going to be doing is she's going to be bending that knee up behind her. All right, and gently back down. You want your hips to stay level throughout all of these exercises. Great. All right, and the last exercise, number 4, is called standing hip flexion. You may have to take a tiny step backwards so you don't bash your knee in front of you, but what you're going to do is you're going to be doing like a partial march. So she's going to be lifting that knee in front of her. Great. Again, you're going to be doing 10 repetitions of each of these 4 exercises 3 times daily.